You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He says no more dentures. We've had him on the program before, and he is Colorado's go-to implant dentist. With us, we have Dr. Taher Dhoon. Dr. Dhoon, welcome to the program.
Yeah, thank you. Thanks for having me.
All right. Now, I know you brought a stack of photos.
Yeah.
So since last time you were here, a few years ago, what's changed? It's gotten better, you say, faster.
Yeah, I mean, so we came on the show, we talked about what we do, and it just opened my eyes at how many people out there in northern Colorado, Wyoming, Nebraska, just need this type of service. It was eye-opening to see how many patients who saw the program gave us a call, and now I've actually stopped doing fillings, I've stopped doing crowns, I've stopped doing root canals. There is such a need for this that I'm just busy doing implants and surgeries. Now, I love orthodontics. I love seeing the kids and like treating them through the years. So I still do the orthodontics for the practice as well. But we are just so inundated with patients who need this type of procedure.
And so a lot of people see you on the program and you say that they watch it over and over and over, maybe even for a year or two, and then they finally come in.
Yeah, I mean, so they're sitting on the sidelines, they're thinking, well, is this right for me? Am I that person that Dr. Dhoon's been talking about? Am I a good candidate for this? And then it just takes up some courage to pick up the phone and give us a call. Oftentimes they're on the sidelines because it's fear, right? Bad experiences at the dentist, bad root canals, bad extractions, things that just didn't go well. And so they sit on the sidelines, they don't want to get back into the system, they hate seeing the dentist. And so when they come and see me, sometimes it's been a couple of years and they just watch the program and they're skeptical.
Okay.
I had one guy come in and say, hey, I'm Mr. Skeptical. And then afterwards we treated him, we saw him, and he's like, you know what, doc, you were right, I'm not skeptical anymore. And
so, I mean, like on a daily basis or weekly basis, people come in with no teeth, walk out with teeth. Or they have really, really bad teeth. Mm-hmm. You remove their teeth, give them a brand new set of teeth by implants. How often do you do that?
Yeah, every single day. Every single day we're in the practice, we are treating patients just like this.
Now you said, I think you said, you consider yourself like the premier center in Colorado for implant dentistry. Elaborate on that.
Yeah, I mean, so we do this so often, we do this every day. At one point in my career, I mean, we go back in time 8 or 9 years, and I just started doing this procedure. It took time. I was nervous. Now we do it so regularly. We have this dialed in. We have all the digital systems in place. My team is amazingly trained. Other dentists actually call us, and it started off, they just come to the office and watch us do the procedure because they wanted to learn how to do it. It's such an interesting thing to do. It's so life-changing. I've never had a patient after I did a filling stand up and give me a hug. Okay. But I guarantee you, 95% of the patients we treat, guys, gals, roughnecks, whatever the case may be, like literally some of them are hugging me so hard they crack my back. So it's one of those things, it's the procedure that changes people's lives. We give them their confidence back in just a couple of hours. So to circle back on what you asked me, we have other doctors who will bring their patients in and observe us doing the procedure on their own patients. Okay. And then other times, let's say they're 3-4 hours south, we'll actually travel to their office, do the procedures in their offices. So that way we can reach as many people as possible and do this. I mean, this is the procedure that wakes me up before my alarm goes off. I'm so excited to get to the office and do these types of procedures because I know what it's going to be like for these patients and the life-changing event that this is going to be for them.
Good. Now your center, we should talk a little bit about, and people need to know, look, I'm not trying to side with you here, but you do have a very unique situation. And I interview a lot of implant dentists across the country, but I guess you do it in one place. I guess typically you go to an imaging center, then you go to the surgeon, then you go to another doctor that puts the teeth on top and then maintained elsewhere. And you do it all right there, and you own your own lab, which allows you to do things much faster than most.
Correct.
Tell me about that.
So what we noticed is when we were doing this the old school way of doing it, and it doesn't mean it's the wrong way of doing it, it just takes so much longer. One of the things that people respect these days is efficiency. They respect our ability to see them, get their teeth done quickly, get their surgery done painlessly, do it all in one place. They don't want to go and meet 3 doctors. They don't want to go and commute to 3 different places. They don't want to have to learn 3 different billing systems and get billed 3 separate times. Because you know what happens when you have to pay 3 different offices? What? The price is going to be up. Okay. You come and see us. We have it all in-house. We have the lab in-house. We do your surgery.
But you do so much of this, right? Are you running out of people that are actually headed to dentures? or already in dentures? Are you running out of those people in Colorado, or are there still plenty that need this?
That's interesting that you say that. I mean, we have Mile High Stadium in Colorado. We have the Pepsi Center in Colorado. We have the Coors Field in Colorado. I mean, we could fill up all these places 3 times over with just the patients in northern Colorado who need this type of procedure, and we'd still be busy forever. So at the end of the day, that's why we teach, because I could teach every dentist in Colorado how to do this procedure, and if every patient who needed this procedure lined up and signed up for it, we'd all still be too busy.
You couldn't handle the
there's not a chance. I mean, there's only so much caffeine and coffee in a day to get me through this, and we're busy.
And then the patients you see, are they getting older and older, or younger and younger?
It's interesting. I mean, when we came on the show, initially the only patients I treated were older patients.
The 3 years ago or so.
Yeah, okay. Exactly. It was just patients who had been in that terminal dentition, bad breath, failing teeth, ailing just health, just in general, or already in dentures. Now, after we came on the show, it opened up a lot of people's eyes to what's possible from a younger age. A lot of people who are younger have bad teeth. We don't see them all the time on the streets. I see them in my practice, but we don't see them on the streets all the time because their mouth is closed.
They don't smile.
They don't smile. We confuse them as unhappy people. Their families and friends confuse them as unhappy people, but that's not really the case. They're just embarrassed. They just don't want people to look down at their teeth as soon as they laugh, and then they feel embarrassed about it.
So you're getting like in the 40s, 50s now.
Yeah.
All the time.
Yeah, I mean, one of the patients here who we treated, she actually ended up working for me too.
Okay.
She's in her 30s.
So what's your oldest patient that you've ever given new teeth to?
Yeah, Charlotte's 87 years old, old Spitfire. And it was interesting that when we were in the consultation, her daughter was sitting next to me. It was one of the most profound moments in my career. I mean, granted, this is years ago, and Charlotte's probably in her 90s now at this point. But her daughter asked her, "It's like, Charlotte, or Mom, why are you doing this? Like, why are you making this investment in your teeth right now? You're 87." And it was such a beautiful comment that Charlotte said. She said, "You know what? I'm getting older, but I don't want to feel older. I want to eat and chew the foods I want to eat. I want to spend time with my friends, and I want to do it to my last day." So, I mean, that in itself solidified, why we do this. It doesn't matter if you only got 5 years left. It doesn't matter your age. Implants don't discriminate against age. You can.
So 87 is definitely not too old.
No.
So when a 70-year-old tells you, "I think I'm too old for this,"
well, it's logical to think that way.
Okay.
So in medicine, in traditional medicine, as you get older, the complications go up based on the procedures you do. In dentistry and implants, it doesn't work that way. So it's logical to think that age is a restricting factor for you. But when you're older with dental implants, it does not matter. If you're healthy enough to hop in the car or get a ride and get into my chair, you're probably healthy enough to get implants placed.
And everything we're going to talk about today, you teach other dentists.
Yeah,
is that
absolutely.
correct? And they fly into your courses.
Absolutely, yeah. They fly in from different states. We have one guy coming in from Canada in a couple of months, and then also, locally, regionally, the dentists will drive in. They'll bring their own patients in, and they'll treat them in our center and under our supervision.
Now, does it cost more to go to a guy like you?
The
top of his game.
The funny thing is, it costs less to go to us. It costs less to go to us because we're so efficient. We're so streamlined. We own the lab. We make the teeth ourselves. We don't have to go out to 3 different places to do this. So we actually just pass that savings on to the patient.
So now that you have your own lab and you do it this way, could you ever go back to the other way, which is how typically it's done?
No, I would retire.
I
would not go back. It's just so easy. It's so predictable. It's a computer program. So patients will bring in pictures of their smile in their 20s. And all we do is we take that, we import that into a computer program, and we just recreate that. It's never been easier.
You brought photos, like a ton of photos. What are we looking at?
Yeah, well, let me show you. I mean, Ruben here, one of my favorites. Just his story is so amazing. His story is absolutely phenomenal. So Ruben, Marine veteran, he came in, he was actually referred to us by 3 different dentists. He's seen 3 different dentists. They all said you do not have enough bone
to get dental implants.
To get dental implants. And so I was actually a little bit nervous when I heard that, because 3 other guys said, you don't have enough bone. So when he comes in, we get the 3D scans, we do the whole workup. I go in the consult room and I talk to him. I look him dead in the eyes. I'm like, "Ruben, we can get this done for you." And he had his son's graduation from the Marines coming up also, and he wanted to surprise his son with a brand new smile. His son has never known him with good teeth. His son has never seen him with a perfect smile. And so he went to his son's graduation, and it was the most amazing thing.
This is his after.
This is his after.
It's very nice. So,
Yeah.
so in the before, those teeth are just hardly hanging on.
Yeah.
He would have had a denture.
Yeah, absolutely. The only thing that he could have had was a denture. Ruben used to carry a pocket knife in his pocket, so when he would eat an apple, he'd have to cut the apple because he couldn't actually physically bite through an apple.
So now this is just upper and lower teeth that don't come out?
Upper and lower, full arch of teeth, held in with implants, all done in one morning, never come out.
Now, I interrupted you, but you were saying his son never saw him smile. Like, didn't think of his father as a smiling guy.
Just never saw him with
And what happened after
good
this
teeth.
was all done?
I mean, I hear Ruben, when he enters the office, I could be on the other end of the practice. He is so happy, he is so full of life, he's so full of joy. And one of the most profound things here that we're gonna see is it doesn't only change your self-confidence or the patient's confidence about themselves, it changes the way their families look at them. Because if someone sees you, if my wife saw me unhappy all the time, or the perception of me being
like
unhappy all the time,
face.
yeah, that would affect her, that would affect my kids negatively. But then I come in, I'm smiling, I'm laughing, I'm confident about my smile. That carries on over into their families. And so like husbands and wives and sons and daughters come back and report in on like how much happier that their loved one is because they got this procedure done.
We've talked about this before, how it changes their appearance. I mean, here's an example of looks different.
Yeah.
More handsome.
He's
looks
more
younger.
handsome. He looks younger. Some people say, like when you have bad teeth, you don't seem intelligent. It's a stereotype. It's a very common stereotype. Like
bad teeth, people with bad teeth are judged.
Absolutely.
Okay, yeah.
Absolutely. If someone showed up for an interview and they were smiling versus someone who wasn't smiling, who would you hire? Exact same resume. You'd hire the person who is smiling.
That looks happier,
Yeah.
or confident.
Absolutely.
Okay, good point.
So let me show you this picture here. So this one ties in exactly to the question you asked, because Kelly over here, she actually came in as a patient, bad breath, bleeding gums, not confident about her smile. Like getting that smile out of her, I had to like.
Well, this is a young person.
Very young.
She would have had a denture?
Yeah.
Like that was her option?
Yeah, or she could have had major surgery that was old techniques we've done so many years ago that aren't predictable.
Okay.
So that's the thing. Like some of the techniques that I was taught when I was coming out of dental school were there to just, kick the can down the road. Have someone be in pain, but at least have their teeth.
Like a patchwork kind of a thing?
Patchwork dentistry.
Okay.
Right? And now we have all this new technology, all this new information, all these new techniques to do it in just one morning, and it's predictable for 20, 30, 40 years. I mean,
what do you do for her?
No-brainer.
So what?
She got a new set of upper teeth and new set of lower teeth. And here's the beautiful thing about it. 2 different people showed up. I met the person at the consultation who we met for the first time, and then I met Kelly. Confident. She goes out to the bars with us. She has fun with us. She talks, she lights up, she tells jokes. She actually is working for us now.
That's good. That's a good story.
Yeah, so Randy, look at her smile line. Look at the difference between the before and after. In the before, her teeth are flat. That's a sign of an aged appearance because you grind your teeth down. Now look at her after picture. The teeth are pointy. They fit her smile line. They follow her lips. They give her
look
this
natural.
this youthful appearance. It changes someone. It makes her look 10 years younger in just one morning.
And the design of this, in some cases, they even meet with your smile designer or something like that, you told me.
Yeah, so we have the lab in-house, and one of the beautiful things about that is if you go to any other traditional office that doesn't have an in-house lab, you're not going to meet the technician who's actually painting everything and doing the cosmetic work.
All right.
The beauty of this is that we get to meet the person who we're going to design those teeth for. So we're going to get pictures of them and say, what's natural here? What shade, goes well with your skin tone? What follows the lip line? How pointy do you want the teeth? How rounded do you want the teeth? If you're old school roughneck, I'm not going to give you Kelly's teeth. That's not going to look normal, right? I'm going to make them a little bit more square. I'm going to make them more masculine. And then vice versa, we're going to pick out something for Kelly and something that's age appropriate for her. So let me show you Diane over here. She has an absolute amazing story. I mean, she couldn't eat the food she wanted to eat. Now, here's the thing. Humans are very adaptive. So she thought she could eat the food she wanted to eat. She thought that she was getting by with a bite that didn't fit well together or the lack of teeth. But
That's
then,
like little nubs in there, almost.
Yeah. People will
She's
adapt.
not too far gone to be able to get implants?
No. The beauty of it is we've been trained on special ways to do specific, more complex implants for patients who would otherwise be turned away from 99% of the other dentists.
Okay.
So there is almost no situation that we will ever say to anyone that you don't have an adequate amount of bone to get implants placed. So almost everyone is a candidate for this procedure. And then look at our after picture. You know, what happens when you don't have teeth is the teeth hold your facial dimensions open, right? If you pull a tooth, the bone is going to shrink. If you pull all your teeth, the bone is going to shrink on a massive scale. So your cheeks aren't supported, your lips and your facial profile is unsupported, your nose and chin get closer together, you get that very aged appearance. I mean, she looks 20 years younger.
She definitely looks younger.
Yeah.
In this, and it's just teeth. She's got. What does she say? Like when it's all done, she looks at herself in the mirror.
Yeah. So, and that's what we do. We
But I
hand
know
them
they're
the
a little
mirror.
bit sedated, so it's tough.
Yeah.
Right.
Yeah. Well, I mean, the beautiful part of it is every response is a little different, but there's always a similarity between it. It's always the look in your mirror, and then they have to kind of look away for a second because they don't quite understand and they don't quite put it together in that instant about what they're seeing. It's like a second chance. It's like hitting the reset button. So they look at the mirror again, you know, and they'll smile or they'll pull their lip up a little bit, and they just don't believe what's just happened in that short period of time, because when you're sedated, it feels like 5 seconds. So imagine in 5 seconds, I just hold up a mirror and everything is different for you. It's one of the most profound experiences.
So they're numbed up. You give them some IV sedation.
Yeah.
So they don't feel anything.
Yeah.
And then they wake up with very little memory, you say, of the procedure.
Absolutely.
Sometimes.
So if you go the sedation route, there's very little memory associated with it, but that doesn't mean you have to go the sedation route. You can just get numb normally, like we would do it for a filling or a crown or a root canal, and then we do the procedure.
And she can eat whatever she wants.
Yeah, anything she wants. I mean, you can eat peanut brittle, you can eat steaks, a thick juicy steak, you can have carrots, you can have apples.
Do they ever call like a little afraid, like say, Dr. Duda, are you sure I could eat whatever?
Yeah, they come back in at their post-op and they're like, you know, I've only been having smoothies, especially like someone like Ruben. I was like, Ruben, we've been talking about this steak forever. Go order the steak, go order the bone-in ribeye, and go to town, enjoy that. I mean, you deserve it. You've been waiting this long, go and order that steak and go eat the steak. All right, let me show you Alan.
All right.
Alan is one of the most charismatic guys I have ever met. I actually book extra time for him when he's on the schedule because we just talk about everything.
All right.
And he's just amazing. And so you can tell. Look at his before picture. You can tell that he's someone who's naturally happy, but the smile is worn down. It is completely worn. His
So
smile
you couldn't
is,
save those teeth?
Oh, not a chance. Not a chance. But here's the beautiful part about it. I mean, he was told by other people that he only could be a denture patient, that he didn't have enough bone, that he wasn't a good candidate. And in the first 5 seconds, I look at his CT scan, I look at his 3D scan, and I can tell him, like, you're an amazing candidate for this, Alan. Let's get you started. And so you can see in his after picture, I mean, look at his nose and chin, they're further apart. Look at his facial support. I mean, he's already a happy guy. He looks happier. You know, he lights up every room he goes into.
Dude, it's just, you know, and I always tell you off camera, it's just teeth, right?
Yeah.
But, you know, I think anybody looking at this, it's more than just teeth.
Yeah, and here's the thing, I'm a dentist, I'm biased. You know, teeth are important to me. But if you look at any study out there, right, any study across the board where they rank people's physical appearances or their natural attributes, teeth are always in the top 3.
That's fair.
They're always in the top 3. It's front and center. 99% of our body is covered with clothes, but then if we get out there, we meet somebody and they smile and their eyes turn on, I mean, that means a lot. A smile means a lot.
Charisma comes from smiling and talking, obviously.
Yeah. Charisma, I mean, it's a subconscious thing that when you smile and you have bad teeth, you subdue it. And then you consistently subdue a part of yourself for so long that it's a muscle. If you don't use it, you lose it. So even confidence is a muscle. Charisma is a muscle. So if we give someone back their smile, I mean, it's almost instantaneous that they turn this thing on. Within a week, they come back, their hair is done, their skin looks better, their clothes are better.
They're smiling all over town.
All over town.
Taking selfies on Facebook.
Yeah. I mean,
those obnoxious selfie people.
You know, if these patients do it, I'm okay with selfies. All right, Randy, let me show you Scott.
All right.
Scott, you know, tough guy. Jaw muscles, they're like vice grips. He's broken his teeth through the years. He works in an industry that's very stressful. This is done in one morning. Look at the after picture.
Very nice. So he would have been wearing a denture too.
He would have been breaking his denture. Imagine someone with this strong of a jaw muscle with plastic in their mouth. They're going to snap that denture in half every 2 to 3 years. And guess what that means? That means more expense. That means more of that goopy impression material in your mouth every time you got to get the denture made. So with Scott, I mean, we placed some implants, got him his teeth the very next day. And here's the thing, a lot of people don't break the temporaries, right? Scott can break temporaries. So then we over-engineered, we redesigned his temporaries in a way where he couldn't break them anymore. But even people who can break their natural teeth can break temporaries. But the zirconia material, the stuff we transition you to at the 3-month marker, consider it like as strong as metal. It's cosmetic, it's porcelain, it looks beautiful, but it's as strong as metal.
So they're never without teeth, by the way?
Never. Never. We wouldn't have all the reviews we have if I ever sent someone out of the office without teeth.
So even with a bunch of extractions, they're going to get implants, teeth on top.
Teeth that very day.
In that day.
Yeah. We have a 3D printer that can, I press a button and it's literally printing and the teeth are ready.
Those teeth.
Yeah.
If somebody's watching this, let's say this is a Monday.
Yep.
If everything worked out perfectly and they were in a rush, they could have their teeth in a couple of days, 3 days?
They can have their teeth that very same day.
But you want to do at least 2 or 3 appointments.
Well, so
no?
their temporary teeth, if they had implants placed today, they'd have their temporary teeth that day.
But they don't come out.
Never come out.
They're fixed, okay.
Never come out.
So really in one day.
In one day, in one afternoon. We're so efficient at this that I can do this procedure as fast as I can do a root canal.
Nice.
To do it properly, it takes about an hour, hour and a half to do this now because we're so efficient. All right, so let me show you Alice here.
All right.
Alice has some of those special implants. Alice, 5 years ago, would have been told, you cannot get implants, period.
Why?
Just lack of bone. A significant amount of infection that had destroyed her architecture, her bony architecture, really precluded her from being a candidate. She would only be in dentures. But because of the skill set we have with these special implants that we can place, now she has a fixed full arch of teeth. And look at her. I mean, she looks so much happier. She looks just so much more fulfilled. And then the beautiful thing about Alice, when she looked at her teeth, her husband started crying. He was in the room on the reveal, looking at his wife, looking at her smile, and seeing the joy in her face, and it brought tears to his eyes.
On these consults, somebody's telling you their hard luck story about their teeth. And do you ever kind of in your mind get excited, like thinking, they don't know how good this is going to be?
Yeah, every single time. Every single time. Because we've done it so much, I can see what it's going to look like, and I already know how I'm designing this in my head from the consultation.
Do you think they underestimate what just having strong teeth can do?
Yeah, well, so here's the thing. Some people want form and function. Some people come in, they're like, hey, I look at the menu, I can only eat 2 things off this menu, or it might fall out and my friends may laugh, right? Ruben had comedy bits set up for when something bad with his teeth would happen in a public instance. He already had things he could diffuse the situation with. This is how, this is the life of a denture wearer. You know, they take their teeth out and put it in a jar at the end of the night, and then they take it out, take that molasses type of adhesive and put it in and stick their teeth in. And then they go out and they plan their day, and they make sure they don't do anything that's gonna put them in an instance that's gonna have them be embarrassed. And then they don't go out to lunch with their colleagues, and then they don't go out to dinner with their friends, and they find themselves becoming more and more introverted, not because they want to be introverted, but because their teeth have made them that way.
And like sports, like water sports are out if you're wearing a denture.
Not a chance. I mean, that's the most expensive water sport trip you're ever gonna have if your dentures fall out in the lake and then you can't do anything.
So no more dentures. That's not just like an expression.
It's happening. It's happening. Since the last time we talked, I don't think I've actually made a denture. A traditional denture. I don't think I've made a traditional denture in 3 years because we can make this affordable, because we have financing options for people, because we have the whole thing streamlined. We've made this so easy for people to get this done that I don't have to make dentures anymore.
It's very nice. Now Medicare, Medicaid, even the best dental insurance doesn't cover it, only covers a very, very small portion.
Yep.
But people are financing
a lot of people finance this, but also if you do have traditional Medicaid or traditional insurance, you know, granted I speak dentistry very fluently and my team speaks insurance and Medicaid very fluently, I would say give us a call. We have specific ways to work within the Medicaid system.
To get some small portions covered.
To get them teeth, to get them this procedure.
And we're short on time, and I know you have a couple more photos left, probably time for one more.
Yeah, I got a stack here, and so right here we got Jimmy. What I want you to see with Jimmy here is like just how much healthier, how much happier he looks you know,
Jeez.
with his new set of teeth. Or Michelle, right? Nobody sees Michelle's teeth before this procedure was done. She did not smile at all. And then look at her after. Look at like how much healthier
That's a big
she
difference.
looks.
That's a big difference.
Yeah, she's so much happier. She eats healthier foods.
And everything you're showing me here, their options would have been a denture.
Yeah.
And
yeah.
so these are now upper and lower teeth that don't come out.
Yep, don't come
Okay.
out, period. We got Jim here.
Teeth look pretty good.
Yeah, well, those are his, befores. So his teeth looked good, right? Theoretically, but they were moving. Every time he bit into anything, they all flexed and they moved. So at the end of the day, he needed something secure. So he didn't look bad, right? He's still a good looking guy, didn't look bad, but he couldn't eat nutritious foods. I mean, when we go to the doctor, what do they say? Eat more fiber, eat healthier foods, you're pre-diabetic, whatever the case may be. By having good teeth that can chew through foods, you're actually going to be able to be a healthier version of yourself. So that's why these.
His after looks good.
Yeah, I mean that's why these patients look healthier, because they actually are physiologically healthier by having teeth. And then we have Martine over here, same thing, decay, bad breath,
Looking
gum
good.
infection. I mean,
Definitely adds to his appearance. Makes
Yeah.
him look a little younger. He trimmed up his beard a little bit.
Yeah.
Looking good.
and the chin and nose get further apart. So we give them this rejuvenation that occurs, but we're also giving them health. So it's like having a facelift done, but we're actually not ever picking up a scalpel to do that. We're just restoring your teeth to the way they were when you were 17.
We're out of time. Final message. Somebody watching this, you know, nobody likes going to the dentist, but they've heard what you had to say. Maybe they've heard you or seen you on television for 2 or 3 years, but they can't get themselves to do it. What do you say to them?
You know, what I would say to them is when I was 9, my dentist growing up was old school Navy. And, you know, I was getting a filling done, really small filling. He started drilling on it. I was like, hey, you know, I kind of feel it. And he's like, no, you don't. And he kept going. That moment is seared into my memory. Now, I can only imagine what it's like to be on the hard end of dentistry, getting bad root canals done, getting bad extractions done, having infection, having pain, going in and having the expense not be worth it because you're still back in the chair hearing bad news every time you're there. We've constructed the office in a way to decrease your pain, decrease the bad experiences, get you to the finish line in a way where it's predictable. We respect your time, we do it quickly, we do it efficiently, we have the best technology to do this stuff. And here's the thing, it's a free consultation. Like, what's the worst that could happen? You come and talk to me, you hear about what we can do.
You know your options.
I think it's more expensive not to know what's going on than it is to at least know what's going on. And I love this stuff. I will talk to you. I will tell you everything you want to know about dentistry. Getting me not to talk about dentistry is the trick. Okay. So anyone who's interested in this, anyone who's been through the bad stuff, just give us a call when we're here to help.
Okay, good. I want to thank you for coming to the show. Great stuff.
Yeah, appreciate you.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.